Hi, I'm Olivia Klund, a future speech language pathologist. If you think about your day, charting, giving handoffs, updating families, it all centers around communication. But for many of our patients, that ability is disrupted. Whether by a stroke, a brain injury, or a progressive disease, suddenly they can't express themselves or swallow with safety, and that's where we come in. In medical settings, SLPs are key members of the care team. Our work covers far more than just speech. We assess and treat disorders that affect swallowing, communication, thinking, memory, and voice, things that deeply impact safety, independence, and connection. One of our biggest roles is managing swallowing disorders or dysphagia. This can show up as coughing or choking during meals, or more silently as aspiration, which can lead to pneumonia, dehydration, or malnutrition. We're trained to identify these issues early, often before they're obvious to others, and help create safe feeding plans or recommend instrumental testing. We also treat aphasia, which is a language disorder that affects a person's ability to understand or express words, common after a stroke. Then there's apraxia, which makes it hard for someone to coordinate the movements needed for speech, even when they know what they want to say. And dysarthria, which involves weak or uncoordinated muscles for speaking, often making speech slurred or hard to understand. Another big part of what we do is help with cognitive communication, skills like memory, attention, organization, and problem solving. These challenges are common after a brain injury or in conditions like dementia and can even make basic tasks or safe discharge difficult. Something many people don't know is that we also work with patients who have tracheostomies or who are on ventilators. We help manage communication for those who can't speak, and when appropriate, we trial speaking valves to safely restore their voice. That can be such a powerful moment for patients to say, I love you again, or to simply ask for something that they need. We also make sure swallowing is safe, especially while breathing is altered. And if verbal speech isn't an option, we support patients with AAC, alternative and augmentative communication, which includes everything from simple picture boards to high-tech devices, depending on the person's needs and abilities. We serve a wide range of patients, adults with strokes, Parkinson's, ALS, or brain injury, and medically complex children with feeding or communication challenges. We work in acute care, inpatient rehab, outpatient, skilled nursing, and even home health. We also work constantly with nurses, physicians, OTs, PTs, dietitians, respiratory therapy, and case management because when we all work together, our patients do better. For me, this all goes back to something personal. When my cousin Isaac needed speech therapy in kindergarten, I saw how powerful it was when someone finally helped him to be understood. That made me want to help others find that same connection. And in medical settings, we bring that same impact to people at some of the most vulnerable points in their lives. So if your patient is coughing while they eat, struggling with memory, can't find the words to speak, or has a trach and no voice, please think of us. SLPs help prevent complications, support safe discharges, and most importantly, help people feel human again. Because communication isn't just about talking, it's about connecting, and everyone deserves that chance. Thank you.